Okay, welcome everybody to this side event, COVID-19 Tsunami of New Technologies for the Common Good or the Corporate Interest. My name's Tom Wakeford from the ETC Group. We are a small international civil society organization that monitors new and emerging technologies, particularly their social and environmental impacts, potential impacts, and looks to bring them under democratic control. We're joined today by my colleague Silvia Ribeiro from also from ETC Group. I'll hand straight over to Silvia to start us off, and I think Silvia, you're going to share your screen. Thanks very much.
Yeah, hello everybody. Thank you for being here today. And yes, I will now ask to share my screen for a little while. Okay, so my idea is to give just a general idea of what we are thinking around. I'm sure that this, particularly this pandemic, has put on the table a lot of thoughts for all of us on the potential impacts and the impacts of new technologies, how they are governed, the impacts, the unequal impacts on different levels and so. But let's say that we already, not before the pandemic, and this is one of the issues we have been discussing at the UNSTI forums, is the convergence of very extreme technologies, the acceleration of this convergence, which is among other fields, the way we have find constructive is to say that there are a set of digital and data-driven technologies, automation and sensing technologies, molecular engineering, including biotechnology, nanotechnology, and earth systems, including, for instance, geoengineering, gene drives, and other ways of doing full ecosystem geoengineering. So before I get into the technologies, I would like to remind for ourselves the main causes of the pandemics, and not only this one, but also the previous ones, and the ones that may come very soon, because the causes of the pandemic are basically untouched. And for us, one of the main causes of the pandemics is the industrial food system, both from agriculture to food, because it's linked to the major diseases, to all the comorbidities like diabetes, obesity, cardiovascular diseases, different kinds of cancers, and so that are in reality, before zoonotic diseases and infectious diseases, we have more than 70% of the fatalities, of the death causes in the world are on non-communicable diseases, and most of them are related to the industrial food system. So the other like 25, 28% of infectious diseases, the main cause of the zoonotic diseases are again related to the industrial food system, because the confined industrial livestock breeding, like caused, for instance, the avian flu, the swine flu, and now it's also related to this pandemic, which is attributed mostly to bats. But the reason why bats left their natural habitats is because of the destruction of their habitats. And the main cause of the destruction of these habitats is deforestation, which is up to 80%. Also the expansion of industrial agriculture. So all these different factors, together with other political, social factors like the dismantling of national health system, of the increase of poverty and inequity in the world, are the real causes behind the pandemics. So all these causes are basically untouched, but we can see the trends that has been accelerated during the pandemic. And the clearly one is digitalization during the past year. So it has been a big expansion of digital platforms, for all kinds of uses of the use of big data and the cloud services. And those were already subject to a very extreme market concentration. So we have this famous so-called GAFAM, but also we call BAT, the Chinese one. GAFAM stands for Google, now Alphabet, Google, Apple, Facebook, Amazon, Microsoft, all based in the US. And in China, mainly Alibaba and Tencent, but also Baidu and others. And these GAFAM and BAT control the vast majority of all digital platforms. So before the pandemic, they were already controlling around two-thirds, 70% of the digital platforms, much more of the big data, the artificial intelligence systems, and much more concentrated on cloud services. So this was before the pandemics, but with the pandemics, they have really expanded in all kinds of industries, but particularly in services that are essential for common people, for most of people in the world, like education, like health systems. So it has been a digitalization and a platformization of these services in the hands of more or less the same, I mean, with variations, but this corporate concentration that were already before the pandemic has accelerated during the pandemic and accessed new fields, new activities that are essential for the lives of all. And all this carries, of course, an enormous data extraction at all levels, from people, from institutions, from cities, from ecosystems, from territories. I don't have time to speak more about the expansion in food and agriculture, but several new deals are done with both, on one hand, supermarkets, but also in the fields. And so the data extraction is not at all a secondary activity for these platforms, is probably their main activity. This is what gives us more money. And it's also a reason why the corporate control and the profits from this corporate control has increased enormously during the pandemic. So for instance, the tech titans, as they are used to be, have made the largest profits during the pandemic. And we are speaking about close to $1 trillion. In a few months during the pandemic, the 10 richest men of the world, they already had done half trillion in profits. So which could go a long way in many senses for things that are needed to confront the pandemic and to prevent it. But they were not used there. They were just profits, private profits. And all this in a context of lack of control and regulation on most aspects. I put there on all aspects, which is true. There are very, very restricted control and regulation of these platforms. And together with this, it has been developed new niche industries that are based on control and surveillance systems. For instance, for COVID tracking, this is one of the things that made that different platforms for tracking has been expanded to a lot more percentage of the population. New industries that were already in place has got much stronger, like for instance, biometrics, and all this in a kind of strengthening what do we call we at ETC, but they call themselves hyper-nudging, which is not only collecting data, but also influencing the behavior of human collectives, groups, etc. Another thing is that all this has been with humongous private profits, but still the companies demand that are the states that build the infrastructure, the communication, the infrastructure for storage, for many things, so they can really expand. And another consequence of this is the unprecedented private use of the space. This is something totally new for the 5G technologies, where we are almost already in more than half. I mean, they were around 2,000 satellites in use around the Earth. And now we already have more than 1,000 new private satellites, particularly for 5G technologies that are already put in the space. So these are just to give you like some of the main examples. But of course, we also have big pharma, and big pharma is, along with technological titans, is the big winners of the pandemic. They have gone to this very narrow teleological approach, which is not addressing any of the causes, not about preventive health or anything, but really to get patented, experimental, untested, priorly untested vaccines. For instance, those, particularly those that use DNA, RNA, and vectorized vaccines, instead of proven methods. Because there were a lot of proven methods, like, you know, attenuated virus and so that could be used. But instead of this, we are seeing really in the world the most, probably the largest massive experiments on human beings about priorly untested technologies. And these companies have used huge public subsidies. Basically, they didn't have any financial risk. They have, in most cases, the big pharma that is already in the market and you know, using vaccination, providing the vaccines that are used for vaccination. Most of them were already subsidized by states, but still they have these really onerous prices, secret functionalities. In my region, in Latin America, they have even asked states to put like the public assets as a warranty for accessing to vaccines. And Moderna are already pushing for applications on the same methods to other diseases, other RNA vaccines to other diseases. Is what they call a new golden age of vaccinology based on untested technologies. And besides that, it has been an undermining of the UN system that instead of strengthening public, transparent, democratic systems, we are seeing private-public partnerships like COVAX and Gavi, which has pretty much taken the role of the World Health Organization instead of strengthening the United Nations mechanism. So these are some of the things that the pandemic has put on the table very clearly, but there are alternatives. For instance, we cannot allow in the framework of the STI, in any other framework, but particularly in STI, we have to understand that it's not that we need technology for technology in itself. It's because we need to address what the problems we have, the needs we have for the majority of the people. And this is about addressing the causes of the pandemic, not just the symptoms. One very good example is that we have these alternatives. We know how to do it. Small food providers, peasants, urban gardening, and many others were and are still the most effective during the pandemics. Those that reached to most people, that were not broken chains because they were local, decentralized supplies, and in most cases that were, you know, with fresh, very safe and nutritious food. So this is the kind of systems that needs to be strengthened. And the recognition that the support and the correction and support local and indigenous knowledge and technologies that can be useful for both food and health, which is not an opposition to use other kinds of technologies, but this is what reaches most of the population, is preventive and is affordable and is decentralized. It is in our hands. So other STIs, I remember clearly, I was in every STI, and other STI forums have recognized that to comply with the SDGs, what we need most, it was even mentioned, 70% of what we need is about the strengthening and recognizing, support and share these local knowledge systems and diversity of technologies. So my colleague will speak more about, you know, some of what we call what we can do for technology assessment, people's technology assessment. But there is one thing that is clear for STI, and is that these purpose of horizon scanning has to be more complex and not focused only on extreme technologies. It has also to see how can other alternatives, other technologies take a part of this, and they can be very innovative and inventive, and they can also be traditional. But also for the technologies that are in place, we need a lot of more independent oversight and public policies. So I hope that we later will see some of our proposals to how to go there through this platform that Tom Wakeford will introduce later. Thank you very much.
Thank you, Silvia. The format we're going to use, we're going to hear from our 4 speakers we just heard from the first, and then we will open things up to questions, and the panelists will also be able to comment on each other's contributions, but you can also add your questions in the Q&A. You don't have to wait till the end. We'll move on now to Anita Gurumurthy, who is the founding member and executive director of IT for Change. Anita, over to you. Thanks.
Thank you so much, Tom. And happy to see friends in this small and cozy group. I think what I'm going to say is not really unfamiliar, and I think Silvia has done wonderfully to lay down the context. And I think the context is pretty scary in many ways. I think when I really look at the way by which digital technologies and artificial intelligence is reshaping the world, what we see in terms of global inequality is pretty unprecedented. And it's no coincidence that digitalization and inequality in the past couple of decades have gone hand in hand. In some ways, I think that really shows how globalization got some kind of an edge in deepening the crisis that we were already facing in advanced capitalism. Today, we actually see AI threatening not only to displace lower wage earners, but also to completely destabilize, in the name of flexibility, the way in which work life is organized, and also render completely irrelevant, traditional definitions we have of what work is and who workers are. So at some level, I think when we talk about science, technology, and innovation, this entire concern that we have at the back of this particular landscape in terms of the future of work, as more and more gigification happens, is what we really need to concern ourselves with. So the questions we need to ask at the larger economic level really pertain to what is the nature of innovation that can deepen, livelihood security, what can really contribute to well-being. These are very significant questions. Secondly, despite a lack of law regulating and governing the use of AI, we've actually seen the public authorities and governments around the world have been rushing to deploy various intelligence-related technologies. And the most egregious in this regard is the use of facial recognition technology. And in many countries around the world, we have seen facial recognition databases have been used to target people in protests, rallies, and this has become really the order of the day. And this is being done without a law to govern facial recognition technologies in the countries in which this is being undertaken. One of the most widely seen interventions to tackle the spread of the virus, for instance, has been the use of contact tracing apps by governments around the world, and the extended surveillance on citizens and the kind of naturalization almost of a new kind of contract between state and citizen through these surveillance technologies. That is, if you care about national security, if you care about public safety, you should subject yourself to these invasive surveillance technologies, is the kind of rhetoric that is being pushed. Also, datafication has led to the hollowing out of public benefits and public interest. So increasingly, we do see that as mainstream sectors, as the real economy, so to speak, has been getting datafied, we really see a shift towards privatization. So again, these two connections seem to be happening. And of course, in the field of education, in particular in the developing parts of the world, we have seen a significant push for online education. And this has just meant platforms coming in and taking the space of public schools and public instruction. I think the pandemic also witnessed certain important flashpoints. And I think one of that is in terms of global cooperation, in terms of data sharing to develop a vaccine. With increased calls for open access to data around viruses, the WHO set up a new data sharing protocol to make research data related to the virus readily available for widespread use and distribution. I think it's important to underscore that data for innovation and access to data for innovation is extremely important, but we also do recognize that there is extreme inequality in terms of how open access really operates in terms of who finally benefits and who actually is giving into this pool without actually getting back at all. Two prime examples: in the case of the Ebola virus, Regeneron received orders worth several hundred millions for the treatment, which was actually a result of the digital sequence information that came from West African genomes. The problem here is that we have anachronistic frameworks and global international frameworks which seem to operate in favor of richer countries and their corporations. The coronavirus vaccine development also witnessed similar issues when Oxford University's Jenner Institute went back on their decision to provide the vaccine to any drug maker. And finally, instead, they signed this exclusive deal with AstraZeneca, as we know. So the whole idea, and again, permit me to use this overused cliche, which is about disaster capitalism, right? So the power of data science and the increased role of big tech in servicifying everything has really reached the zenith post COVID. And what we really see is Amazon in particular saw massive growth. And last year, when everything was crashing down, the stocks of Amazon and the private wealth of Jeff Bezos was increasing astronomically. The immense rise in value also provided the perfect opportunity for tech companies to enter new markets. And if you take the case of India, for instance, Facebook came up with many innovations. They set up something called a WhatsApp storefront. So if you're a small retailer, you're trying to make ends meet, then you could actually set up shop on WhatsApp. And during the pandemic, they even set up a facility for users to buy from local shops so that you can hollow out the local economy of, mom and pop stores even further. They also rode on top of the unified payments interface, which is basically a digital infrastructure, which is a public digital infrastructure of the Reserve Bank of India. And there were free riders trying to build these payment apps and payment services. So actually, essentially being subsidized by public digital infrastructure to extract from the economy. One sad thing is also governments have increasingly turned to big tech companies to help with pandemic mitigation and recovery measures. And this has entrenched the power of big tech companies into the social fabric by allowing them to build and control key public infrastructure. And this really is not only true for the developing world, but in New York, for instance, former Google CEO Eric Schmidt is going to be heading a Blue Ribbon Commission to reimagine New York State's post-COVID reality. It's not enough for citizens to imagine this. You need corporate support to envision what democracy is going to look like. So in all of this, there is also one anomaly I'd like to point to before I conclude with, I think, where we need to really head, which is that global rules with respect to data and artificial intelligence operating through existing trade rules are really, I think, extremely crafty. And I think global civil society organizations, which really are interested in reviving multilateralism that is democratic, have to pay attention to the fact that data is being debated and transacted in forums that data was not meant to be debated in. So very often you see data converted into a trade issue. Data flows have to be governed and regulated independently, and we do need a new global arrangement for this. But this is hurting developing countries a lot. So sustainable and inclusive innovation in the field of digital and data technologies, I think we need deeper thinking around data governance and how frameworks for accountability will be evolved. And this is actually very, very large, because it's not only about the digital behemoths that we're talking about the digitalization and datafication of all sectors. Sylvia just mentioned big pharma, and big pharma has ceased to be pharmacological. Big pharma is now technologified in terms of their digitalization. So we need to start thinking in the upcoming biodiversity conference, for instance, at the end of this year, about what do we do about digital sequence information. It is a new kind of a category, and conventional access and benefit sharing frameworks under the Nagoya Protocol, for instance, are not really going to be helpful, because the digital sequence information allows you to produce things in the laboratory that completely negate the need for a pathogen, right? So what you really conceived of a decade ago, what you have been able to sidestep and circumvent for corporate profiteering through the digital sequence information. We do need polycentric frameworks for data governance, from reimagining smart cities to thinking about global data constitutionalism, to looking at how data trust can be not just a Eurocentric European idea, but looking at going beyond this kind of consent frameworks where you individualize these data contracts in a market. You really need to start thinking about how you can completely re-envision a post-market but democratic data phenomenon. And data also is an extremely important jurisdictional issue for digital development of nation states, which is why I think nation states should be allowed to explore public data infrastructures and not allow these public data infrastructures to be hijacked by multinational corporations. Traditional instruments like competition law, etc., are useful, but we do really need newer instruments, and we do need also a very strong role, and this is my last point, for global financing. And into the financing for development conversations in the UN, we do need to bring ideas of what we're going to do about the digital capabilities of developing countries without really thinking of it as largesse, As such, through open data flows, northern companies are taking away the data in what has been called data colonialism. So what we need is a rights-based, justice-based access and ability to deploy data in the global south in public frameworks and infrastructures. Thank you very much.
Thank you very much, Anita. I'm going to move straight on to our third speaker now, Dr KM Gopakumar from the Third World Network. Thanks very much. Over to you.
Let me just continue with the theme left by previous two speakers. I'll be focusing mainly on the issue of concentration during pandemic as a case. I would like to bring the case study of vaccine. As all of us know that even the pre-pandemic period, pharmaceutical as a whole is controlled by a few companies, control the entire value chain of the pharmaceutical industry. To give a small example, if you take the India's pharmaceutical industry, the market value of India's pharmaceutical industry is around $26 billion. That includes export and import. But if you take the value of the three highest selling brands or the top selling brands of pharmaceutical products, that surpasses this $26 billion. So just three medicines revenue surpasses the entire market value of a country like India. So that means a few companies could control the substantial value of the medical pharmaceutical products, especially medicines. Medicines. Similarly, in the case of vaccine, actually China and India, because of their population, have in terms of volume, ranks around first and second position in terms of vaccine production, primarily due to the universal vaccination program and these countries having the ability to produce many of these vaccines required for universal immunization. But if you take the value of vaccine or rank them on the value-based vaccine, then we find that 5 developed countries accounts for the nearly 82 or 83% of the vaccine market. So in vaccine, especially, there is a very, very concentrated area, concentrated marketplace, and this is primarily controlled by a few handful of companies. Generally, pharmaceutical companies uses intellectual property rights and regulatory framework. So they use the intellectual property rights and regulatory framework to control the market or control the competition. So now let us, against this background, let us look at the COVID vaccine. So unlike the vaccines which we know, COVID vaccine does not prevent infection. The other vaccines, the idea of vaccination is to prevent the infection, but the COVID vaccines are not supposed to prevent infection, but they are supposed to prevent the severity of the infection. And we were told that nearly at least 70% of the population coverage is required to have a population-wide effect of this vaccine. So if 1 or 2 people having vaccine, of course, they are protected against the severity of the infection, but to have from a public health perspective, you should have a substantial coverage. Then only you can get the benefit of the vaccines. That basically means at least 70% of the global population needs to be vaccinated. That takes us to the, and even also they say that we need booster doses due to the new strains which are coming in. That basically takes us to the issue of how many doses we require. So all of us can guess that we need around 11 billion doses to have around 70% of the or 80% of the coverage, vaccination coverage. As of now, around 14 vaccines have been approved by the various regulatory agencies, and the number of vaccines in the WHO's emergency use listing are only 3 vaccines from 5 manufacturers, because the AstraZeneca vaccines licensed to South Korean firm and Indian firms are also part of the WHO listing. That makes it 5 manufacturers. And we have been using various technology platforms except mRNA vaccine platform. All other vaccines, platforms are there. 1 or other vaccines are in the market. But when it comes to mRNA vaccine technology, it's the first time we are having a new vaccine. So just keep this in as a background information, and we will come back to some of these issues later. So what's the logic of making, to have a massive vaccine campaign? They say that the reduction of severity will reduce in turn the run for the hospital, and therefore the health system will not face this stress which we are witnessing in many countries in case of a further surge in the surge of pandemic. So therefore it does make the idea, it does make sense to have a massive vaccination, and that can in a way normalize some degree of normalcy in our socioeconomic sector or life, then they do cite examples of Israel or even UK. Some people are saying that UK is going to be on Israel's way once the vaccination is happening. So this is the logic which is given. We are seeing some progress in Israel and in UK, but again, these are all threatened by the fact that if the new variants comes, whether these vaccines are capable to provide that effectiveness of the vaccine. So against this background, people call vaccine as a global public good. So many world leaders, including President Macron, Chancellor Angela Merkel, even the President of European Commission, UN Secretary General, all call vaccine as a global public good. WHO resolution says that vaccination is a global public good. Keep this in mind, and then now we look at it. What's happening? So as of last week, around 1.6 billion doses administered. And out of this, 70% is concentrated in 4 geographical locations. So EU, if you take it as a single political entity, around 4 geographical areas accounts for more than 70% of this 1.6 billion doses of vaccine. How this concentration happening? That's very clear. Other countries are not getting the vaccine, and the availability is a big issue. And at the same time, if you look at the price varies from $2 to $40 per vaccine. And there are situations that the same company sold vaccine at different prices. Please recall there was reports that the Uganda had to pay $7 per dose, while European Union paid only $1.73 for obtaining AstraZeneca vaccine. For the same vaccine, Uganda had to pay $7 per dose. So this shows that there is a shortage and prices are high. Normally, the conventional sense, the more competition is supposed to enhance the production as well as reduces the price. But however, most of these originator companies and many developed countries are not ready to give up the control on the technology. So, what's happening with the vaccine technology is that there is a complete socialization of risk and privatization of the profit. And data shows that around 90 out of the $93 billion US spent on vaccines and treatments, nearly 95% of this 93 billion. So there is, the way I put it, slightly, it may create some misunderstanding, but the figure is that $93 billion were spent on vaccines and treatment. Out of this 93 billion, 95% of it went to vaccine. And there is a less involvement of private sector resources into the vaccine research. That way, this vaccine, all these COVID vaccines are in a way, it's a public good. But at the same time, people need to recall the debate on intellectual property and medicine. The primary justification for intellectual property was at that point of time is that to recoup the R&D investment. So here, you don't find any kind of need for recouping the R&D investment because it has come from the governments. The public money, but still the pharmaceutical companies do not want to give up their monopoly. And the government who spend the money are ready to give further incentive to the pharma, and in a way the citizens are made to pay 2 times for this vaccine too. Basically, the control on technology is carried out through patents, trade secret, and regulatory framework. So I'll take 2 or 3 minutes here. Patent, all of us knows that patent prevents others from using the invention, and it's very straightforward way of providing the statutory monopoly. The trade secret is slightly tricky here when it comes to vaccines. Unlike the small molecules, which like a paracetamol, if paracetamol is produced by a generic company, the regulatory authority is not going to look at what kind of manufacturing process the generic company followed to produce the paracetamol. They will look at whether it is a paracetamol or not. If it's a paracetamol, then generic company get the marketing right and to market the product, and that basically will bring competition into the paracetamol market. So unlike paracetamol, when it comes to vaccine, the company which is the generic company which is producing this vaccine has to prove safety and efficacy. If that company does not obtain or did not obtain the technology from the originator, to make it much more clear way of saying is that if the technology has not come from the originator, any company which is replicating this technology has to prove safety and efficacy. So this way, the trade secret protection in a way controls the competition in the market and aiding the concentration of technology. But if you look at from an IP law perspective, trade secrets are protected to the extent where you are prevented from replicating the technology using any illegal means. But if you are using your own technological capability, there is no bar. You can replicate the technology. But here, the regulatory framework, which putting these conditions of proving safety and efficacy independently of the originator, in a way prevent the companies who are having the technological capacity but do not have the enough financial power to carry out the clinical trials, are prevented from replicating the technology. The regulatory framework is basically required because it is supposed to ensure the safety and efficacy of the any medical products introduced in the market. But a few occasions, the regulatory framework, there is a regulatory capture to create an entry barrier using the regulatory framework. Often we heard about the regulatory capture is to ease the regulatory requirements, so therefore certain business players can capture the market or rig the rules in their favor. But I will give you one example of, it's not related to vaccine, but the biological or biotherapeutics, like a monoclonal antibodies. If any generic company which makes this monoclonal antibody, not the originator company, to replicate the a product of a originator company, till now, as per the WHO guideline, you are supposed to prove the safety and efficacy through a comparative clinical trials. So there are scientists who have written enough volumes to show that this does not make any sense. As a result, now the WHO has proposed a draft guideline which takes away this requirement. So this is an example where the regulatory capture also can take place in such a way to create entry barriers. So this is an example. So this is the same way it, in a way, happens. It also happens in the case of vaccines. So that please keep this also in mind. And vaccine, when we talk about vaccine, COVID vaccines, we do not have clear idea about how long the immunity of this vaccine exists, whether we require a booster dose or not. We don't know. Pfizer has already announced that booster dose is required. And vaccine also, some scientists say that there will be a vaccine-induced variants. And all those things, again, these very basic of how the vaccine works, the efficacy of the vaccine is all depending upon the data generated through the clinical trial. So many, none of them have none of us have access to this data too. So this lack of transparency creates the speculation and trigger vaccine hesitancy in a way. Let me move to my next point. As I told you that there is a lack of shortage and lack of affordability. This is mainly emanating from the concentration of production and concentration of technology in a few hands. They are using intellectual property rights and regulatory framework in their favor to continue the concentration and continue the monopoly power. At the same time, we should also keep in mind that many of these vaccine manufacturers, there was a lot of lowering down of the regulatory guard to expedite the vaccine approval. But the same level of expedition of the non-originator vaccines, when it comes to non-originator vaccines, these kind of concessions are not available too. So against this background, the South Africa and India approached the WTO to waive the waive the intellectual property rights related to medical products using for the COVID response. So that proposal is now at the WTO, and a few countries are opposing it, though it enjoys around two-thirds support of a two-thirds membership. So main opposition in the context of vaccine is that if you waiver of will lead to undermine the innovation, and it may lead to what you call not optimized form of technology transfer. You need IP to do the technology transfer, as if there was no technology transfer without IP. And undermining the innovation, which I told you already, these are all heavily funded by the public fund or governments. So therefore, there is no question of undermining of innovation happens. Let me conclude by saying is that if you take vaccine as an example, we see that though there is termed as a global public good, but the realization, the translating the concept of global public good into reality, there is a huge gap, and we also need appropriate regulatory framework to end vaccine monopoly, because the current framework actually contribute to the monopoly. Everything is done in the name of safety and efficacy. I'm not saying that safety and efficacy should be undermined, but we need to really look into the scientific evidence for all these requirements, and whether it is required, whether alternatives are possible or not. And transparency of data, which is completely missing. If you want to have a technology assessment, what you require is a availability of data. In the absence of data, you may not be able to carry out a technology assessment. And against this background, I'll just give you one example where the vaccine companies in a way prevented from that to happen, because WHO was one of the response of WHO during the in the beginning of pandemic was that they announced the possibility of carrying out a solidarity trial. So even for the vaccine, solidarity trial was proposed, because all these vaccines can be used for the clinical trial under the solidarity trial framework. But none of the vaccine companies participated in the trial. Therefore, the solidarity vaccine trial did not happen. If that would have happened, we would have much more evidence. It is transparent to show the various aspects of technological as well as pharmaceutical aspects of vaccine in the public domain. But that possibility was curtailed by the pharmaceutical companies by their refusal to participate in the solidarity trial. Let me stop it here. Thank you.
Thank you very much, Gopad. It's so important that we hear this from a perspective of somebody living through the pandemic in India, because I think what the point you've made is that this is a problem for the whole world, that you're highlighting the important issues there, but it applies to us all in that this virus is not going away, and we need to make sure the risk is not just taken by those who have least in the world for the benefit of those who have the most. So thanks for that, and Anita. Because of timing, I'm going to make a very short presentation to allow our panelists to comment on them. We talked about, all the panelists have talked about the need for technology assessment. And you may remember, if you were following the area at the time, that back in 2000, at the turn of the millennium, we were being told that genetic engineering would feed the world. It would reduce the use of toxic chemicals. And 20 years later, there are more hungry people than ever, even before the pandemic. And chemical use has actually gone up, including chemicals used on genetically engineered crops. And that has had direct health impacts. So if we'd had technology assessments 20, 21 years ago, even earlier, then the world might look different now. And one thing we haven't touched on directly today, but on the other major current threat that hasn't gone away despite the pandemic of climate change, we have Bill Gates, the co-founder of Microsoft, saying we should follow his company's example of all being carbon neutral by 2030. But to do that, he's gambling on geoengineering techniques to make clouds reflective, or growing more genetically engineered crops, burning them for energy and then burying the carbon. The world's politicians are already banking on the idea that geoengineering will be a success, but there's currently no evidence that it will. So what we urgently need now is technology assessment. And then, as you heard from Anita Gurumurthy, the mega tech corporations from Silicon Valley and digital platforms around the world are telling us that we can digitalize every element of our lives, every element of ecosystems. We can replace farmers with precision robots. We'll lose our personal privacy, will be surveilled. But they claim this will address not just climate change, but hunger, future pandemics, and biodiversity loss. But to test these claims, we need technology assessment. So the resource I'm going to introduce to you now, just by showing you the website of Assess Technology, which should be coming up now, is a website that just provides some resources about, firstly, right at the bottom here, what do we mean by technology, because it doesn't just mean gadgets. It's something that I think everybody on this, all the speakers on the panel would agree is a political, something that always has political dimensions. We survey the different forms of technology assessment going on in different parts of the world. You'll see on the left here, we have Red Tekla, the Tekla network in Latin America. We have in Africa, the AfriTAP network, the Africa Technology Assessment Platform. And in Asia Pacific, we have emerging now TAP app, Technology Assessment Platform, Asia Pacific. So you can read much more about what's going on in these places and access all these resources. There's a menu where you can look at resources, and this is available in not just English, but French and Spanish. So I'd encourage you to look at that, and I can come back to that when we've had some questions and answers, and we're also going to have more time to come back to this in the webinar tomorrow, which is starting an hour and a half later, where we'll be giving examples of technologies that have been assessed, and to some extent their application has been halted by collective action. So I'm going to open up now. What I'm going to do is I'm going to go to attendees, and if you could put your hand up if you have a question, then I will try and let you present your question in person, and we can also address questions that have come up in the chat. So if you have a question, please put up your hand, and I can unmute your microphone, and you can talk. I see Marta from the UN Major Group on Children and Youth is with us. I wondered, Marta, whether you might want to ask a question to the panel.
Certainly, and thank you for all the interesting and different reflections on the need for technology assessments and the work that is being done with assessed technology. More broadly, are there considerations? I see that the assessed technology website uses regional considerations or regional technology platforms. Are there broader principles that can guide a more global framework of technology assessments, or do you think that technology assessment should be more regional? And a follow-up question, how can those regional technology assessment platforms be adapted to locally specific contexts?
Okay, thanks very much, Marta. Let's go to the panel with that, and maybe if I take it in the order that people spoke, and they can comment on that question, but also they can comment on what they heard from the other panel members. So if I could go first to Silvia. Thank you, Silvia.
Thanks, Tom. I think it was really interesting. Thank you, Gopakumar and Anita. Well, I cannot thank Tom really because we are in the same organization. I think, Marta, your question is extremely important. And Marta from the Major Group on Children and Youth, I think, yes, it's not only regional, it's not only about regions, it's about a participatory technology assessment that can take into account many different perspectives, including, for instance, the perspectives of younger people, the intergenerational justice, just to mention things that you probably are working on, but also many of the things that were mentioned by Anita and Gopa that we need to take into account, like, for instance, the barriers of intellectual property, what means all these technologies for people, and so I'm sure Tom will add more to this about the criteria. I just wanted to say that the examples that Gopakumar took, and also Anita, are extremely relevant in this situation, where we have a situation in the world that is really increasing unfairness, and technology is being used extensively as a way of increasing this inequity. I think inequity in many senses, like even in the access to treatments, and so I would like Gopakumar to speak a few minutes more, if you can, on this challenge about intellectual property, but not only, like you said, it's also about trade secrets. It's not only about just intellectual property, it's also about many other issues that have been used to prevent access. So it would be interesting to hear more. And I really thank Anita for this very broad presentation over different issues. And I say that I totally share the concern about how this data extraction is being used. Not only the extraction itself, but for instance, the example you put about face recognition, and how is it using even in difficulties when people doesn't is in more is in worse situations, and lots of these new technologies are being used for more control. So no, it's just to say that I think that this kind of perspectives has to be taken into the STI as things of evaluating technology on a multi-purpose way, and not only for the technology in itself, but also all these different impacts it may have. I can cut it here to give time for others, or maybe there are other questions. I don't know.
Thanks very much, Silvia. Because I know Anita has to go very shortly, I wanted to give her a chance to come back on anything you've heard. Thank you, Anita.
Thanks. I just wanted to respond to Marta's very important question. I think the meaning of technology assessment in the age of data means actually we have to really infuse that with very, very new meaning. And why do I say that? I think there is a need for polycentric assessment criteria, standards, norms, and principles. We do need no-go areas at the global level. So we've all heard of Shoshana Zuboff's book on surveillance capitalism. And even if we haven't read it, there is a very important part she introduces in the book, which has something to do with human futures, trade in human futures. So what does she mean? She looks at the financial industry and, talks about this kind of predatory behavior in the market, and you have the data to manipulate, play. That the insurance industry can actually look at connected cars and make out, whether you're this risky driver and therefore your insurance premium has to go up. But all this has disastrous consequences, not only for, let's say, a middle-class consumer or a rich person, but they have enormous consequences for the majority of people who are dependent on public provisioning and public systems, poor people in developing countries. The models of learnification in education have changed the way in which a child can feel free to explore the world. Today in schools, Google will offer you a suite, right? An analytics suite, which will tell you exactly how to chart the pathway of whether this child is capable of becoming an engineer or incapable. So if your destiny is already, written in some way because an algorithm classified you as a person not deserving of the opportunities to take up engineering education, then you can imagine how layers and layers of exclusion, bias, and discrimination in society, on account of which poor people, marginalized sections of the population have not been able to come to the center of the economy and society, will be further marginalized because an algorithm just treats, poverty and marginality as incidental to its modeling, right? So we have to think a lot about what is out of the window, in our assessment. We simply cannot afford to go in the direction of facial recognition technologies, and we have to outlaw certain things at a global level. That doesn't rule out the need and the urgency for developing countries, for instance, to have local policies and laws, especially for, let's say, digital innovation and data regulation for the sake of economic development and local livelihoods. So I just will stop here. This is a topic which deserves its own, kind of debate. But what I'm trying to point out here is we need to operate at a polycentric way in order to reconceptualize our governance of especially intelligence-based technologies.
Thanks very much, Anita. And in case you do have to leave us for the end, thanks very much for making the time. Gopa, do you want to answer on this round? Reflect on other contributions?
No, not at this stage.
Okay.
Later on, I can take on to explain further on the IP control over vaccines, but later on.
Okay, thanks a lot. I just wanted to come back on this issue of to Maz's really helpful question, I think, because I gave a very quick sort of justification for a technology assessment, but I wanted to answer your question about how this interface between local and regional levels happened, and really sort of who, I think this is partly what you're driving at, like how is it decided what technologies are assessed and by who? And I think the general principle we use, and Silvia may want to expand on this from the Latin America perspective, is that you start with the reality of the people in popular movements and social movements who have got a process within themselves of popular education and dialogue, and they've already discussed the issues that face them. And then there's a sort of process of dialogue where groups like ETC, IT for Change, and Third World Network, I'm sure, talks to them about the issues we've just discussed here in this side event now, and says, well, there's things that you might say are largely not the realm of new and emerging technologies, like land rights, rights to water, women's rights to reproductive rights. And then there are these technologies like digital surveillance, facial recognition, genetic engineering, and there's then a discussion about what is their priority. And I think it's very much a process of discussing whether these technologies are something that they prioritize, because only when it's a priority will there be enough time made in their lives to discuss them, because these are voluntary discussions. And I'll just give you a concrete example of in West Africa, where the Bill and Melinda Gates Foundation are funding Target Malaria to develop a gene drive technology that they say will help control one of the vectors of malaria. There was a process that the Target Malaria carried out, where they said they had spoken to the relevant local people, but actually what one of our colleagues, Zada Malou, found when she went and interviewed people in the area is that people didn't know this was going on. They certainly didn't know any details of the risks they might be exposed to if the gene drives were to be released. And so several groups entered a dialogue as part of what's now been called the AfriTAPS process, the African Technology Assessment Platform. And these discussions are ongoing, and we're developing materials with them in both French and English and local languages. This is particularly in Burkina Faso, to allow them to assess this technology that has not been released yet, but within just 2 or 3 years' time is potentially releasing an irreversible experiment on them. And you'll hear more about this tomorrow, so I don't want to steal the thunder of the speakers we have tomorrow. But that is, I guess, a regional issue in West Africa. In fact, increasingly across Africa, these gene drive mosquitoes are the Target Malaria have already announced they're going to set up releases in Uganda and other parts of West Africa, East Africa, Uganda, Kenya, and then West Africa, Burkina Faso and Mali. And so this is actually happening in communities at a local level, in terms of these conversations happening subject to the pandemic, actually face to face, between communities and the organizations and the popular movements. So I hope that's a helpful answer. I just look to any of the other panelists who want to come in, or I've just seen a question from Nimo Bassi. I wonder whether we could allow Nimo Bassi to ask his question directly. I've just unmuted you, Nimo. I wonder whether you're able to join us.
Okay, thank you so much, Tom. Two questions. One was, I was really impressed with Silvia's tracing of the roots of the pandemic to industrial agriculture, and I think this is a big issue. But it does appear that the world, especially the media, is not so much interested in tracing the roots of the problem, rather than just reporting the fatalities and what is really making the news at the moment. So how can we overcome this problem? That's one question. Second question is, I'm personally very troubled about India, what's going on, but the news is really horrific. And I wanted to know if the mortality rate is spread evenly across the nation, or there's more in the urban or rural areas, that kind of, just for the knowledge to see whether there is something that can be understood in that direction.
Thank you very much, Nimo, who's director of the Home Foundation in Nigeria, and also involved, just to declare an interest in the AfriTap technology assessment platform in Africa. Because it's so late in India, I wonder whether I could ask Gopa to respond to that, and if you need to go, that's completely fine. We'll probably wrap up in the next 5 minutes or so. But if I go to Gopa and then finally to Silvia. Over to you, Gopa. Thank you.
Yeah, thanks for.
And anything else you want to wrap up as well from other points? Yeah, thank you.
Sure. Thank you, Tom, and thank you for raising this concern about outbreak in India. And because you asked, it's mainly the more deaths are happening in the northern part of India, not the southern or the western part of India. So it's mainly in the northern part. Most of these deaths are happening. Some part of it's like west, if you include like the states above Maharashtra. I don't know whether you know the location, but roughly it is the northern part of India. Much of the deaths are happening. The numbers in the south also is high, but still under control. Even in the state of Maharashtra, like you might have heard, the Bombay, the city, the numbers are coming down now. It was daily reported cases were around 10,000 plus 3-4 weeks back. So now it has come down to 3,088, 3,880. That range. Okay, so that's showing a slowing down of the pandemic in this major city. Bombay is the largest city in the country, so there it's showing a slowing down, and hopefully we think that maybe the next 15 days or something, there will be some kind of control over the spread of the infection. And now we are more or less in the lockdown and other things. I think those measures are going to give some dividends to those part of the cities where things are really bad. Oh,
Thanks
sorry.
very much.
Just one
yes, please.
point. What I'm saying is that in the case of a small molecule, if there is no patent, generic company gets a freedom of operation. There is no transfer of technology. You can easily bring the product in the market. But when it comes to vaccine, because of the trade secret, though you have the technological capability, you cannot bring the product because regulatory system insists that you should go and bring the technology from the originator, especially the bio vaccines. You need a cell line. The starting material should come from the from the originator company. As a result, the clout of the originator company is so high, it creates a very asymmetric power relations, because even in the absence of a patent, still a competitor may not able to bring the product in the quickest possible time. They have to depend upon the originator. So that's a problem with the vaccine regulation as of now. These regulatory agencies, in a way, protecting the trade secret of the originator companies. But it's done with the idea of to ensure safety and efficacy of the vaccine. But the science have developed over a period of time. We have the technologies. We need to, what I'm saying is that science is always evidence-based. So we need to look into the evidence, how much of this regulation makes sense and how much it does not make sense. I'm not saying that you do, take it away, but we should have a evidence-based approach to this question. Because otherwise, it's helping concentration rather than actually, really protecting the safety and efficacy. I'll give one example and stop it here. Say, for example, in the case of biosimilar guideline, you are supposed to do a comparative clinical trial between 300 to 500 people. That's the number of people you have to do this comparative clinical trial. So 250. If you have a 500 clinical trial subject, 250 in the originator medicine and 250 in the newly developed biosimilar. So this is the way to do the comparative clinical trial. And the idea is that to find out whether there is any statistically any significant difference between the originator's product and the biosimilar product. So this is the idea. So people who are expertise in the area are telling me, with this 500 people, you cannot make out any kind of significant statistical significance, actually, especially when it comes to a treatment for cancer, because the originators and the biosimilar is very difficult to at that 500 numbers. If it's a 25,000 people, you can have it, but then the regulatory agencies say 500 is good enough. So these are the it become a bureaucratic exercise rather than an evidence-based exercise. So that's a problem. I think we as a civil society, we should always ask for the evidence and we should always ask for the transparency. Therefore, the transparency is very critical. The transparency can in a way check the corporate cost for concentration.
Thank you, Gopal. Just before I go to Silvia, I just share a sort of paradox of this sort of the patents and the ownership of technologies that we were told near the beginning of the pandemic that, of course, patents had to stay because otherwise anybody could just copy these brilliant designs. I mean, this has been the defense of pharmaceutical companies for patents for many decades. But now that things are clearly going in a terrible way in India and other countries of the global south, and the governments are knocking on their doors saying, please, can you release the patents and allow us to make them? They're saying, actually, it's really hard to make these vaccines, and so we don't want to release the patents because you'll make them wrong, and you haven't got the capacities and all these things. So you wonder whether this same argument might be used in the future with the high-tech agriculture, that actually they say, you'll need Bayer and Chem China and these other companies to run your agriculture for you because you can't be trusted, you won't do it right. So maybe a simple-minded comparison, but one that I feels very poignant at the moment as the world teeters with this pandemic. But Gopa, are you coming back on to say one more thing, or shall I?
It's already mentioned here. That's what the Bill Gates said, that these technologies cannot be shared because of our funding. We build the capacity, otherwise it is difficult to replicate. So same thing can happen in agriculture or even many areas. Okay, one more thing: the main cost of development of a medicine, they always say that it's a cost of clinical trials. So now there is a possibility that the big data can be used, okay? But now, whether that is going to bring down the cost of production, whether are we going to get the medicine at an affordable price, then they may say that it's a big data generation itself is a big investment. So we don't. So I think corporate will find one or other reason to keep their control on the technology, basically with the cost of to ensure the profit. So that is what happened in the case of vaccine. They told that, okay, we need patent for R&D, recoup the R&D investment. Now the R&D investment has all come from the public funded, or from the governments. But now still they want to keep the control. So let me stop. Thank you. Thank you.
Thank you, Gopal. We're going to wind up in less than 5 minutes, but I wanted to give Silvia a chance to reflect on those inputs. Thank you, Silvia.
Just to answer to Nimo Bassi, thanks for the question. And no, it's of course. I mean, I think it's one of the things that is kind of hidden in the because everybody now is so touched about so many deaths and so, which is really concerning, and also the need to do something. But the causes, which is what is driving the problem. We have to address those, and then the industrial food system has a very large part of it, as well as other extractive and contaminated industries like mining, oil companies, and so. It's just that the role of the industrial food system is so essential because it is related to both this immunological crisis, like the immunological weakness of the people eating bad food or not eating enough food, and also making food that make us sick, obese, diabetics, and all that. So we really need to question this. And your question about how we do this is, I think that one way is just that we need to show this is the reality, and insist on this along with other things that destroy biodiversity. Because a very, very concerning trend that is now is that the discourse about the destruction of biodiversity, instead of linking to, for instance, the advancing of oil industry, mining, mega projects, and the expansion of industrial agriculture, what we hear is that, no, this is about people consuming wild, like wild animals, and the problem is the traditional markets that are consuming wild meat, and this is so not the problem. I mean, the problem is somewhere else. So what we need is to speak more about it and to make sure that we go to as many places as possible about the causes. And this is part also of this, what we call a participatory technology assessment. So I will give the floor to Tom to close here. Thank you.
Thank you very much, Silvia. So yes, just to return to the theme of technology assessment, this can be done in a very, you might say, technocratic or top-down way, where only scientists who have professional qualifications as scientists, who often work inside governments, get to decide what, to put it crudely, the future of technology is. The idea behind participatory technology assessment is that is the people who get to decide what is acceptable risks and what are the real benefits, as opposed to the corporate hype, are actually peoples in all their diversities, people who bring indigenous, endogenous, lived knowledge, local knowledge into their considerations, and who have time to discuss it, hearing from all sides. I mean, there's a very crude comparison with some forms of participatory technology assessment, with putting a person on trial with a jury, as happens in some countries. So you hear the evidence for, say, genetically engineered foods, and you hear the evidence against, and then the convener of this process would allow a long discussion, including cross-questioning of the witnesses, and then they come up with their conclusion. Now, that's a rather crude analogy, but the idea of it, like a legal jury, should be drawn from the whole community. This participatory technology process should also draw from the community, also be informed by the evidence, and come to a conclusion. Now, there are all different ways of doing participatory technology assessment, and the form that Silvia and many others have developed in Latin America probably wouldn't use that analogy, but the general principle of saying the whole process of innovation, from deciding what the research question is, to doing the research, to developing technologies, to deciding how they should be applied, should be opened up so that it's not decided by the richest person or the person who happens to be in government, because we were never given a vote on genetic engineering. We haven't been given a vote about, I mean, thinking of the pandemic, how we should look at this issue of the rights, equal rights to food under the pandemic, and the equal rights to treatment as well, and prevention. So I'd just like to finish by thanking all the speakers and all those joining us and asking questions. We will be sharing a recording of this as soon as possible. And just to highlight that as part of the UNSTI Forum, which formally the proceedings start tomorrow, we are involved in another side event which takes two examples of these technologies, one in which Silvia's been particularly recently involved, of the geoengineering experiment that was proposed in Sweden. And then we'll be hearing from Nicholas Hallström about that. And then Barbara and Tembaweki will be giving the example of these gene drive organisms, these exterminator genes that currently are being proposed for release in Africa. So hope to see some of you there, and thanks for your time this evening, and thanks again to all the speakers and the questioners, and keep safe and be well.